Hello.
I'm Dr. Yang, I'm calling from the GP clinic. Am I talking to Mrs. Mary?
Yes, doctor, I'm Mary. Thanks for
Mm-hmm.
the call.
Yeah. So Mary, could you please confirm your full name and age, please?
Yes, my name is Mary John and I'm
Mm-hmm.
45.
Okay. Can you hear me well?
Yes, I can.
Mm-hmm. So is this the right time to talk with you?
Yes,
Mm-hmm. So can you confirm your first line address, please?
3 Hardman Street, Manchester.
Uh-huh. Okay, thank you. So okay, so is if the phone call drops, can I call back the same number again?
Yes.
Mm-hmm. So Mary, yeah, I have your test result with me. So, yeah, before telling your test result, can I ask you why did you do this blood test in the first place?
Actually, doctor, I just went for a checkup. This was a routine checkup. I wasn't having anything at all. And they did this
Mm-hmm.
test for me. Is everything all
Mm-hmm.
right?
Mary, firstly, I really appreciate you take care of your health. Yeah, your test result is with me. Before we keep on your test result, can I ask you a few questions regarding your general health?
Yes, sure.
Mm-hmm. So, oh yeah, do you have any symptoms at all at the moment?
No,
Mm-hmm. Do you feel any shortness of breath,
no,
any tiredness,
no,
any heart racing?
no,
Okay. Hey, so by any chance, do you notice any bleeding from any part of your body?
no.
Mm-hmm. How about your appetite?
Yeah, I think I'm eating well.
Mm-hmm. How is your bowel habit?
Okay.
Okay. So do you notice any black stool in your in your stool? Any black color stool?
No,
Mm-hmm. Do you have any unexpected weight loss?
no,
Mm-hmm. Any tummy pain?
no,
Any fever?
no.
Okay. Yeah, do you have any underlying medical conditions?
Yes, doctor, I'm having diabetes.
Okay. So, how is your diabetes? How is your blood sugar level?
Yeah, my blood sugar level are controlled and I am just doing diet uh,
Mm-hmm.
planning and I'm doing exercise. I'm not taking any medication for that.
Okay. Okay. So, do you go for a regular checkup with your
Yeah,
diabetes?
yeah.
Mm-hmm. Yeah, that's really great. Okay. Any other medications are you taking, including the over-the-counter drugs?
No,
Mm-hmm. Okay. Do you have any family members who have any medical problem?
yes, my dad also had diabetes.
Mm-hmm. So how is your dad right now?
He is taking insulin and some other medication as well,
Mm-hmm.
and he's okay.
Oh, okay. Okay. So, may I know, how do you have your regular periods?
Yes, doctor.
Mm-hmm. So, do you have any heavy bleeding or painful bleeding?
Yes, my periods have been heavy all the time.
Mm-hmm. Okay. So, since when you have heavy period?
Uh, Maybe 10 years or so.
Okay. Okay. So, did you have any medical attention for your heavy period?
No, doctor.
Mm-hmm. Okay. Okay. So, any abnormal bleeding between your each period?
No.
Mm-hmm. Okay, that's fine. Do you have any children?
Yes, I have 2 kids.
Mm-hmm. Okay. Okay. So, uh, mm-hmm. So how old is your younger kids?
5 years.
Mm-hmm. Okay, that's lovely. Okay, so thank you for answering all of my questions. Yeah, ideally, if it's possible, I would like to examine you at the clinic. So yeah, if you are free, I would like to make an appointment for you. Would that be okay?
Yes, doctor.
Okay. Okay, so yeah, your test result is here. So Mary, do you have any particular concern regarding your blood test results?
No, doctor.
Mm-hmm. Okay. Yeah. When your blood test result, most of the test result are good. Like you have the whole white cell count, your kidney function, liver function are all normal, but yeah, your red cell count is a little bit low, and also your iron and ferritin level is a little bit low. So, do you have any idea why you are having this?
No, doctor. Is everything all
Mhm.
right? Is it something I should be concerned of?
Yeah, I can see you are concerned, but according to the test result, you are having a condition called iron deficiency anemia. Yeah, I forgot to ask you something like, how about your diet? Do you eat all kinds of food?
Yes, doctor. But
Mm-hmm.
I prefer vegetarian. Chicken
Okay.
eggs.
Okay, then thank you for bringing this up. Yeah, so at the moment you don't have any symptoms and you don't have any bleeding, and yeah, so uh, yeah, you had iron deficiency anemia would be because you are because you mentioned that you have a heavy period, so of long-term heavy periods can lead to this iron deficiency anemia. And then also, ions are ion contained in the red meat. So yeah, so you mentioned that you are a vegetarian, so it can also be the cause. Am I making sense to you, Mary?
Yes, doctor. But doctor, I don't know all of a sudden why my iron has dropped so much. Is there anything concerning as well?
Yeah. For that matter, as I mentioned, to be sure, I would like you to come to the clinic, and we would like to thoroughly examine and consult with my senior. And then after that, we will do what we can do for you for further management.
Okay.
Mm-hmm. And during the meantime, you can take the some iron supplement tablets, and also please, I will send you some leaflets regarding the diet, which are iron rich food. Like you can eat some dark green vegetables and also some kinds of peas, chicks and peas.
Okay.
So do you think you can do
Time's up.
that? Mm-hmm.
Time's up. Okay.
Okay.
So yes, Dr. Noreen,
Yeah.
what do you think?
Yeah, actually, for the management, I don't have much idea what should I do for the
Mm-hmm.
management.
Mm-hmm. And what about history taking?
History taking, I cover the anemia signs and symptoms, risk
Yeah.
factor,
Yeah.
complications or not.
Yeah. And you covered red flags as well. Really good. That's really good. And in the management, actually, I'm not concerned about your history taking. You were really good in the history taking. Your IPS is good. You asked
Mm-hmm.
all the red flags. You asked me all the symptoms of anemia,
Mm-hmm.
and you covered gynae history. You covered, and then you forgot about diet. But then you asked me about diet later on in the management. But in the management, there are some things that you can add. We will be talking about those things just shortly. Before that, I'm asking from other people, do you think she has missed anything? Something in the management, something in the history taking? Is there anything you want to add? Anyone, please?
Hello.
Yes.
Yeah. Um, the heavy menstruation.
Sorry?
The heavy menstruation. I think she should have talked more about it being a possible cause or contributor to the anemia.
Yes. Yes, she mentioned about that in the management.
Okay.
And okay, so I have a question for you. If that is the probable cause of her iron deficiency anemia. So how are you going to deal with that? Anything in your mind?
We would have to run some further tests to know the possible cause. Probably we need to do a scan to
Should we
confirm if
arrange
she's
for
having
scan, ultrasound scan?
Not
a
ultrasound
confirm.
scan. I think if you can refer that patient to the gynae, maybe.
Ah, okay.
Yeah, because then they will be able to see, because menorrhagia can be there in different things. Fibroid can be there. Some other things can be there. So even though if it is not concerning for you at the moment and she's not having any red flag sign, that is really good. But if she is giving history of heavy periods and that's there since past 10 years or so, so you can still make a routine referral for gynae, not an urgent one because there is no cancer sign. And then they can have a scan or whatever they want to do, right?
Yep.
Okay, very good. Thank you. So some things I want you to suggest. I want, but Dr. Noreen, when you are asking about some things that are different than the previous section, for example, when you started talking about menstrual history, before that you can signpost.
Ah, okay.
Yeah, because in this way, when you are making a abrupt transition from one part to another, it looks good. Your consultation looks logical and it looks better. So you can say like this, no, a bit about your gynae history, a bit about your gynecological history, some questions about anything you can say for signposting.
Okay.
If you are asking about lifestyle, then you can mention about lifestyle signposting as well.
Okay.
Okay. So let's have a look at the structure. So this structure, okay, we will talk about this later. So first of all, yes. So when you are covering the structure of the history taking, give me a second. I have another. Okay. So when you are gathering data, what are the things you should not be missing? And Dr. Noreem has done all of it. But for other people, first of all, if someone is coming with a symptom, then obviously you are going to identify the symptom and then you are going to explore it. But for this lady, she was not coming with anything. It was just a routine checkup, right? So for her, still you will be asking some symptoms of anemia, and then you will be asking flaw symptom. Flaw symptoms, these are the red flag signs: fever, lumps and bumps, anemia symptoms, appetite, weight changes. And similarly, you can ask about, for anemia, you will be asking about some other things. Like she was asking me about PR bleed. Do ask about PR bleed when someone is coming with iron deficiency anemia, and especially if age is more. Her age was fine, it was not 45. If someone like 80 years or 70 years is coming with PR bleed, that is a red flag. Similarly, in celiac disease as well, there can be iron deficiency anemia. So while you are talking about other things in the history, ask about bowel control, if her bowel habits are normal or not. So it will give you an idea. And then peptic ulcer. Peptic ulcer can be abdominal pain, she asked me. And again, when you are asking about medication, are you using any medication, including over the counter? So if somebody is taking over the counter painkiller, it is a risk factor for peptic ulcer, but it was not there in the history. And then fourth thing is that blood disorders. So she asked me about fever, lumps and bumps. So that's also done. So if somebody is coming with bruising, bleeding, some things like that, then a leukemia can be a DD as well. There can be autoimmune condition. There can be dietary factors, travel history. If there is a significant travel history, then you can think about something like hookworm infestation as well, and then gynae causes. And in our patient, gynae and dietary factor was positive. So these were two risk factors, right? And further investigations. So while we have done all the investigations like full blood count, liver function, kidney function, and we have done iron profile as well. So also you can do TFTs as well and autoimmune profile, Dr. Noreem, but you can tell about these investigations in the management part, right? When you are telling your patient to come to the clinic so that we can examine you then you can do some other tests. For example, in my history, I gave you something positive for gynae. So you can make referral for that. For example, it was a different history. For example, if I am giving you PR bleed history, or I'm giving you heartburn history, abdominal pain history, or maybe I am taking over-the-counter painkiller for my back pain, in that kind of patient, what will you do? What will you do? Will you make a referral?
Yeah, gastroenterologist.
Yes.
Mm-hmm.
Yes. And it will be a routine referral or an urgent referral?
Urgent referral.
Yeah, perfect. And also you can think about some camera tests as well.
Okay.
Yeah. So these things you can mention in your management plan. And then if it is peptic ulcer, if there are any risk factors for peptic ulcer, then you can think about H. pylori testing as well. So this station is very important and it can come in different ways. Okay. So sometimes this station is coming as a station that we did right now. So someone is coming for lab reports, and then you will be following this procedure, right? These are the structure for this kind of station. So someone is coming with the lab result, and you have to disclose the lab results. Along with that, you are looking for risk factor iron deficiency anemia, and then you will be covering the management. But can come in another way as well. Somebody who's coming with tiredness. So in that case, you will deal it with a proper history taking station kind of station, right? So you will ask about tiredness. You will rule out the other things. You will get some. You will be making your DDs like we discussed right now. What are the DDs when someone is coming with iron deficiency anemia? And then you will be doing the management. And sometimes here, before the management, when you will, because if data gathering, if it is a face-to-face station, then you will get some findings. So before management, you will get some findings, some test reports, and at that time, maybe you are having an idea about iron deficiency. And then you have to tailor your management based on your history. This portion can be different, but management portion will stay the same. Okay.
Okay.
Is this thing clear so far?
Yes.
Yes.
Okay.
Yes.
So when we are covering the management, so this is the structure of the management, Dr. Noreen, right? So let's see which things you have covered and which things you haven't. So you disclosed me, that was tick. And then referral, you didn't make any referral. So based on the cause, you have to make some referral. So if gynae cause was positive, so you can make some referral for that. But that was really good. I like this, that you told me about a leaflet for the diet. You told me that I will be sending you some leaflets so that you can modify your diet, right?
Yeah.
So two things. If there is one risk factor, you will address one risk factor. If there are more than one risk factor, you will address all of them. So further tests, if needed. So if there is anything positive, for example, like we mentioned, if PR bleed is positive, then you will arrange some further tests. You will arrange some camera test. If patient is coming with heartburn kind of history, then you will arrange some other camera test like endoscopy. And what is the specific management for iron deficiency anemia? Iron tablets 3 to 6 months you can give. If it is severe iron deficiency anemia, then we can go for IV injections as well. And then dietary advice, you gave me dietary advice, but important thing that you missed was safety netting.
Okay.
Yeah, you should be safety netting and talk about follow-up plan, because if you are not doing that, you are not being a safe doctor. Okay.
Okay.
So I'm sure you are having exam in next few days. So I'm sure you will not forget safety netting from now onwards.
Yeah.
So safety netting.
Actually, because my way you're speaking is a little bit slow. So it's a little bit every time the time management is a problem with me.
But it's okay. I'm not concerned about your time management. You were able to wrap up your data gathering part at about 4.5 minutes. So that was okay. It was not too bad.
Okay. Okay.
Your
Thanks.
IPS is good. Your time management is good. You are doing red flag signs. You are doing all these things. But in the management, if you can, cover safety netting, you can mention about referrals. If So there are different things in the management and in all the stations. I know it might be repetition for some people, but I just want to repeat it because it's very important. If you want
Yes.
to have good marks in the management, then do these things.
Mhm.
Disclose further investigations if you are doing any seniors you involve your senior, good. Referrals or admission. If you are admitting somebody, for example, if you are in hospital, somebody is sick, you are admitting, mention about that. If you are referring somebody, mention about that. And referral can be routine referral or an urgent referral. Routine referral if something that is not uh, very serious or there are no red flag signs. And urgent referral, for example, if there are cancer signs present or red flag signs are present. For example, somebody coming calling you about asthma, and he is giving you some red flag signs of asthma, right? They are unable to breathe and blue inhaler is not working. So what will you do? You will make urgent referral to A&E and you will ask the patient, you can arrange the ambulance so that patient can go to A&E. Yes? If somebody is coming with PR bleed, age is like 65, PR bleed, and there are other weight loss present. So what will you do? Urgent 2 week weight referral to the specialist. Along with that, you can do some investigations as well, some camera tests, and that will be urgent as well.
Sorry. Hello.
Then
Hello.
specific treatment and symptomatic treatment. So if there are any symptom, you can do symptomatic treatment. But in my history, there were no symptoms, so that we can't do symptomatic treatment. But yes, specific treatment will be to replenish the iron stores, and then general tips about dietary advice and so and so. And then safety net and follow up. This is the fifth thing to be covered in the management. Any questions so far?
Yes. Hello.
Yes.
So do we tell them about referral before the other things? Like, is it this order or is just follow everything there? But